Okay, Judy currently lives in Los Angeles with her husband of 7 years and is working on the documentary Life on the Bridge, which is about living life fully with long-term dialysis. She's approaching her 39th year of dialysis treatment. So, today's theme is living healthy with kidney disease. So, excellent. All right. So I think we'll have Judy speak to us a little bit about the other side of the spectrum with hemodialysis. So if you can kind of touch upon what led you to decide to do hemodialysis and what your experience has been in terms of staying healthy with diet and exercise, that type of thing.
Thank you, but before I begin, since I don't have a sense of who is here with us today, I would love a show of hands of people who have chronic kidney disease but are not on dialysis or have a transplant. Thank you, thank you. And how many people are currently doing hemodialysis? Okay, in center? Okay, how many people are doing hemo at home? Okay, and how many people are doing PD? Okay. I actually want to begin by saying this. I started on dialysis very, very young. I was only 15 at a time when hemo was really the only game in town. I did that. Transplants are unfortunately not my game, which I learned through experience. As Dr. Bunapratis mentioned, one of the etiologies of kidney disease is immune system related. That's very complex in my case. And so for me, dialysis is my gift of life. I have done all kinds of dialysis. It's very unusual. I think it's only 3% of the patients in this country, you are one of them and I am one of them, who made a proactive choice to go from hemo to PD. For me, that decision was made after transplant number 2 did not work at all, and suddenly I was back in the unit. And I thought, oh man, I was 27 years old working full time. And how did I choose PD was your question. How did I make that switch? By asking questions. I went around with my pad and my pencil to a few different peritoneal dialysis programs. It became clear to me that the best chances for success was awesome backup, like you're talking about, an education training program that will give you the best possible skills going in to PD and also 24/7 support. I kid you not, there was a program that said, well, you can call us between 9 to 5 on Monday to Friday. Well, I don't think so. When you're on PD and something happens inevitably on a Sunday evening, you need backup within 15 minutes. You need to have, as you do, I'm sure, you need to have a number where you can call and you will get support. That is not in an ER. That is PD support, very different. I had an unbelievable run on PD. I did CAPD for 12 and a half years. No infection, original catheter. Oh, wow. The only reason thank you. The only reason I discontinued was that I was approaching year 25 of dialysis, decided to go for transplant number 3, see if it would help. Where I was fooling Mother Nature for only so long. I was getting a lot of amyloid, which is a byproduct. It's a protein molecule that is very large, doesn't dialyze out easily. And so I was getting a buildup of that in my soft tissues, which is probably why I use my little SUV behind me. So I decided to go for that 3rd transplant. Catheter needed to come out. Transplant didn't work. 3 months it lasted. And I had a very serious education to do, even 25 years into my life with kidney disease. I needed to reassess, reevaluate, look at what my options were. And I'm going to let you in on a little secret. Some of you may not like to hear it. It's a fact, and the fact is dialysis 3 times a week in a clinic is not written in stone and was not handed down from God. It is a purely economic decision for dialysis units to function maximally. It makes sense to have Monday, Wednesday, Friday shifts and Tuesday, Thursday, Saturday shifts. Our kidneys work 7 days a week. That's why when you talk about feeling so unbelievably better doing 6 nights a week, it is not a subjective thing. You are coming very close to physiologic functioning of natural native kidneys, as am I in doing nocturnal home hemo 28 hours a week, 7 hours, 4 nights a week. I have chemistries that if any nephrologist looked at them would look like I had a functioning kidney transplant in me. I swear to you, it's the truth. It's the truth, and I can even tell you. My BUN pre-dialysis is around 30. After the treatment, it's 5. My creatinine is around 3.25. That's like a semi-functioning transplant.
Show
All right? And I'll let you in on something else. Because I'm doing that dialysis very slowly and very gently through the night, I never get sick from the treatment, as I always did during in-center chemo. I am never sick after the treatment. I take no blood pressure medication. And I'll tell you something about my diet. I love food. I have a passion for food. I write a food blog, for God's sakes, and I've been asked by many people, oh, is it for the renal diet? No, it's not. I have created a life for myself that affords me the beautiful joy of enjoying nature's bounty. I eat fruits and vegetables. My phosphorus is so low that I need phosphorus added to the dialysis solution. Okay, why is that? Because something happens to the dialyzer. After dialyzing so many hours, the fibers expand, allowing the larger phosphorus molecules to just ease on out into the dialysate solution and leave my body. So I get to have the, oh my, it's so difficult. I need to have beans and ice cream and cheeses and dairy products and nuts. I can go on and on. I have a very wonderful diet that consists of eating whole grains, fruits, vegetables, proteins. I stay away from processed food. Even healthy kidneys don't know what to do with processed foods and additives. They wreak havoc inside the body, and we have no business eating that, okay? Stay away from additives and processed foods no matter what level of kidney function you have. Eat well in accordance with what your diet is, okay? Move, because we are what we eat. What we put in here has a direct impact on our health, so we need to learn about that. And we need to move our bodies. Staying still is not good for anyone. We need to move. And I think all of this is driven, this is like the short version, if you can believe it. All of this is driven by our own souls, by our own will and desire to be on this planet as fully and as meaningfully as we can be. Our own attitude is really above all else. Viktor Frankl said, though we cannot change the circumstances in our lives, we can control our attitudes. We can control our attitudes. It's reasonable to expect that there will be some points And I've been there, and I'm sure all of you have been there, when you feel discouraged. It's all these G words. When you feel discouraged, when you're feeling despair, distraught. However, we have to move ourselves out of there towards the light of living, towards looking at the positive, because that's what's going to feed us no matter what. I went to college on dialysis. I went to graduate school, going to the unit 3 times a week. Looking back, I don't know how the heck I did that, but I did. And anemic before the days of EPO. I worked with deaf children. I worked with preschool deaf children and their parents. And every year, initiation for these parents of children who are hearing impaired, birth to 5 years of age, the director of the clinic would stand up to a group about this size and would say, your dreams have been shattered. And now we need to recreate those dreams, create new dreams. Yes, it's challenging that you have a chronic health issue, but we are here today to tell you in whatever way that will work for you, and you don't know it until you walk through it, whether it be transplantation, whether it be PD, hemo, home hemo. You don't know what's going to be right for you. No one can tell you what is right for you until you walk through it. You need to recreate your dreams. You need to educate yourself. But you can rebuild your dreams. You can live a full life. It's going to have to come from within you.
Thank you. So to pass the microphone to Basha, I just want to see if you can kind of comment on your experience as a donor. I mean, it's a wonderful gift that you've given. And